At least 2.7 million Americans are living with atrial fibrillation, or AFib, according to the American Heart Association. However, many people who have AFib, they're not getting the treatment they need. Joining us now to discuss Atrial Fibrillation Awareness Month and the treatment of AFib, Dr. Brian Becker, Chief Medical Officer for Ascension Providence, and Dr. Timothy Ball, Cardiology at Ascension Providence and Waco Cardiology Associates. So glad to have, we've got a lot of medical brain power here. So let's talk a little bit about AFib and what it is, and it's apparently something people have and don't really know, Dr. Ball?
Yeah, atrial fibrillation is the most common heart rhythm problem in the U.S. It's basically an irregular heart rhythm. Your heart has kind of two stages, the top part and the bottom part. And when you're in atrial fibrillation, the top part of the heart just really isn't beating. And so oftentimes when that happens, your heart doesn't work efficiently and patients just kind of feel crummy. They kind of feel tired. They don't really have heart-specific symptoms, and I think that's often why it goes undiagnosed. Additionally, early in the disease, it can come and go. So you can have 10 minutes of it here, 15 minutes of it there. Unless you just happen to be at your doctor's office when that happens, you won't know.
So, Dr. Becker, Ascension Providence, of course, the heart hospital, and what do you recommend for folks as we're kind of focusing on AFib? You know, how to see about their own health?
I think it's really important that you maintain a relationship with your primary care physician, that you at least have someone that you see on a fairly regular basis. And recognize that if you're not feeling well, that's a good indication that you should go in and get checked out.
And there's some new procedures that are less invasive that are happening that are now available here in Waco? There
are. So it is important for us at Ascension Providence that we continue to provide the best care that we can in our community when it's appropriate. Through partnership with our cardiology colleagues, over the last 6 months we've been able to expand our capacity in our cath lab and to offer some new services that are minimally invasive, a Watchman procedure that addresses AFib, a TAVR procedure that allows us to replace a valve without making an incision in the chest, are just two of the recent advances that we've had.
Well, Dr. Ball, let's talk a little more about treatment. Normally, you know, you think about, well, just say you take some blood thinners for that kind of thing. What are some of the other medical procedures you're doing now to address AFib?
Yeah, so atrial fibrillation, I like to think about it in two categories. The first is trying to keep people in normal rhythm, keep them out of atrial fibrillation. We have two options to do that. The first is medications. And often medications work well initially. The alternative to medications is ablation, and so in patients that don't want to take medications or can't take medications or fail medications, then we can take them for a minimally invasive procedure where we target the triggers in the heart for atrial fibrillation and burn or freeze those. Second category is the stroke prevention, and that's where we start to talk about blood thinners. Blood thinners have been the mainstay of therapy for decades, but now we have some newer treatments we can use. The Watchman device is one of the newer treatments. It's a minimally invasive procedure. We put this device into the heart, and it prevents blood clots from traveling from the heart to the brain and prevents stroke. And so in patients that are unable to take blood thinner or don't want to take blood thinner, the Watchman's a good alternative.
That's amazing. So how can folks get in touch with you guys to get some more information?
So they can always go to our website. So providence.net is a great place to visit to find access to our physicians and to our services.
Oh, thank you both so much for sharing your expertise with us. All the best to you.
Thank you very much.